Take off.
Well, I've now had 27 meetings on healthcare and healthcare reform. We've met with doctors, nurses, hospitals, small business owners, everyday citizens. And I think the lessons I take from all of these meetings are several. First, that people like the quality of care that we get in the United States, and they don't want that to be compromised. Secondly, there's a strong feeling that we should not go to a nationalized, socialized, Canadian-style healthcare plan. And I agree with that. I would not vote for that kind of healthcare plan. I don't think it would work here in the United States and could be counterproductive in terms of continuing the quality of care that we have. I also find that more and more people are recognizing that doing nothing is not a good option. That while we have, in many ways, the finest quality health care in the United States, costs are going up dramatically, and that's putting a heavier and heavier burden on the budgets of families and small businesses. And I'm particularly hearing a lot of stories about small businesses that, through no fault of their own, had one employee become seriously ill, and their entire healthcare plan for their company, their cost went up dramatically. And we're hearing, both the triumph and the tragedy of the present healthcare system. The triumph being the young mother who survived colon cancer, but in doing so had to accept bankruptcy for her family in order to get that care. And she is now buying sympathy cards by the bundles. When her daughter asked why, she said, honey, it's because I'm seeing women every day who are going to die from their cancer, which was discovered much earlier than my cancer, but they don't have health insurance and they won't get the care that I got. And there are just a lot of stories out there, both the good and the problems in the present system. I find there are two extremes of viewpoints. One is, let's have the government take over everything. Let's throw out the baby with the bathwater. I think that's wrong, and it would not work. On the other hand, the majority of the town hall participants in Waco and Bryan actually favored getting rid of Medicare and Medicaid, along with Social Security. I think that viewpoint is out of touch with 90 to 95% of the people in our district. It doesn't reflect the viewpoint of most families. And the truth is, if we got rid of Medicare and Medicaid, we would shut down or cripple virtually every hospital, every private and nonprofit hospital in our district. So at the end of the day, what we have is a public-private partnership that I think we need to continue. And our goal should be to protect the quality of health care that we have today while slowing down the increasing costs that are exacerbated by the increasing number of uninsured, because there's an $1,800 hidden tax on everybody with health insurance because they're covering the cost of those without it. And so I think the conversations have been so positive. A lot of frustrations about the difficulty or the complexity of the issue and the length of the bill. One of the best questions was from a county judge who said, Chet, where can I get the cliff notes on this bill? And because of the complexity of the bill, it's not only creating frustration, it's allowing myths about the bill to be perpetuated. The worst of which is in this bill that Congress is going to pass a euthanasia program to put seniors to sleep. That is an absurd myth. It's simply not true, and it's disappointing to me that anyone would try to frighten senior citizens with a myth such as that. There are plenty of legitimate concerns to raise concerns and questions to raise about the bill without having to make up myths that are doing nothing but causing some seniors to go to bed with higher blood pressure. So I hope in the weeks ahead we can get people to try to look for common ground, take some of the partisanship that's been involved in this process, and see if we can come up with a way of protecting our high-quality healthcare system while trying to reduce these quickly increasing costs that are hurting businesses and family budgets.